The cardiac monitor is a valuable diagnostic device used by pre-hospital providers of varying levels. Transmission of a 12-lead ECG and communication with the receiving facility are critical to the activation of the STEMI notification system. Patients with signs and symptoms consistent with acute coronary syndrome should have a pre-hospital 12-lead obtained. However, many patients with acute coronary syndrome may present to EMS with signs and symptoms of acute cardiac pathology other than chest pain, including diaphoresis, shortness of breath, weakness, syncope, and nausea. Atypical signs and symptoms of acute coronary syndrome are prevalent in women, diabetics, and older adults. EMTs may obtain and transmit a 12-lead ECG to the hospital for interpretation by an attending physician. EMTs will not provide continuous cardiac monitoring because ECG interpretation skills are outside the scope of practice of a BLS provider. There are many brands and types of cardiac monitors. X-Series units can perform ECG monitoring through 3, 5, or 12-lead ECG patient cables, multifunction pads, or standard defibrillation paddles. The proper application and placement of electrodes is essential for high-quality ECG monitoring. Good contact between the electrode and skin minimizes motion artifact and signal interference. The following procedure will describe how to monitor the patient's ECG using 3 and 5-lead cables. Prepare the patient's skin for electrode application. Apply the electrode pads to the patient. Connect each lead of the ECG cable to the appropriate electrode. 3-lead electrode placement. RA, or the white electrode. Place near the patient's right midclavicular line, directly below the clavicle. LA, or the black electrode. Place near the patient's left midclavicular line, directly below the clavicle. LL, or the red electrode. Place between the 5th and 6th intercostal space on the patient's left midclavicular line. RL, or the green electrode. Place between the 6th and 7th intercostal space on the patient's right midclavicular line. Lead ECG monitoring setup. To set up the 12-lead ECG monitoring, perform the following steps. 1. Prepare the patient's skin for electrode placement. 2. Apply the electrode to the patient. 3. Connect each lead of the ECG cable to the appropriate electrode. 4. Connect the 12-lead cable. 5. Observe the patient's electrocardiogram on the display and adjust the size of the 12-lead ECG waveform traces as necessary. Take special care when positioning the precordial leads because their placement does not follow numeric order. V1. Attach the V1 electrode to the right of the sternum at the 4th intercostal space. V2. Attach the V2 electrode to the left of the sternum at the 4th intercostal space. V4. Attach the V4 electrode at the midclavicular line at the 5th intercostal space. V3. Attach the V3 electrode in between V2 and 4. V5. Attach the V5 electrode at the anterior axillary line in the 5th intercostal space. V6. Attach the V6 electrode at the mid-axillary line in the 5th intercostal space. Note that the V4, V5, and V6 electrodes form a straight line along the 5th intercostal space. V1 position 4th intercostal space is critically important because it is the reference point for finding the correct placement of all the remaining V leads. To locate the V1 position, 1. Place your finger on the jugular notch. 2. Move your finger slowly downward, about 1.5 inches, until you feel a slight horizontal ridge or elevation. This anatomical landmark is the angle of Louis, where the manubrium joins the body of the sternum. 3. Locate the 2nd intercostal space on the patient's right side. lateral to and just below the angle of Louis. 4. Move your finger down 2 more intercostal spaces to the 4th intercostal space, the V1 position. Note, when placing electrodes on a female patient, always place leads V3, 4, 5, and 6 under the breast, rather than on the breast. Entering patient information. To enter patient information, press the 12-lead quick access key, then the patient information quick access key. Entering patient age and gender. To change a default value, highlight and select the parameter and then specify a new value as follows. To change the patient's age, use the navigation keys on the front panel to decrease or increase the default value, which is 45. Then press Select. To change the patient's gender, use the navigation keys on the front panel to toggle between the default value, M for male, and F for female. Then press Select. When a 12-lead report has been acquired or a previously acquired 12-lead has been selected for review, the X-Series unit prepares the report for transmission. When this is complete, the Transmit Quick Access key displays. A list of pre-configured distribution lists appear. Use the navigation keys to highlight and select the desired distribution list. A green checkbox indicates the selected list. When a destination has been selected, the Transmit button is enabled. NIBP setup and use. To take safe and accurate NIBP measurements using the X-Series unit, you must perform the following steps. 1. Select the correct size cuff. 2. Apply the cuff to the patient. 3. Connect the inflation hose to the X-Series unit and to the cuff. 4. Press the NIBP button on the X-Series unit's front panel and take the blood pressure measurement.